Good afternoon, Lynn.
Hi,
How you doing?
I'm doing great.
Uh, you're the new CAO of the Mariposa County uh, John C. Fremont Hospital District, right?
Yes, I am.
And could you tell me a little bit about your background? We've been talking a little bit before this goes on the air, but if you could maybe fill in the audience, you've got quite a background.
Yeah, so again, my name is Lynn Buskill. I have a doctorate in hospital administration. I'm also a master's prepared registered nurse, and that's how I started off in healthcare. From there, I kind of advanced through the manager and the director roles and then the individual hospital roles. But I've spent the last 25 years of my career actually being over hospitals in a more corporate role. So the largest number of hospitals that I've supervised is 186. And that experience has allowed me to gain a wide breadth of tools and experiences. So I specialize actually in turning hospitals around.
And we have a hospital that needs desperately to be turned around.
We have some issues here, definitely. I just did a town hall, and in that town hall, I talked about the challenges that we have here. They range from financial, governmental. We also have some challenges in quality and providers. We have challenges with our staff. We have more staff than we've ever had. We have about 59 more employees today than we did even 15 years ago with the same amount of patients. But even with adding all of those staff, we're still having some challenges getting all the right things done on time. So we're looking and tackling each one of these problems to try to create the best healthcare system for Mariposa and Mariposa County.
And we also have another major task that's been handed to you. We're building a new hospital.
Yeah, I'm really excited. I've actually built 3 other hospitals. This will be my 4th. And I have a lot of experience putting hospitals together. We're looking to, our new timeline for the new hospital will be fall of 2029.
2029. And I've worked on some construction projects, large municipal projects like wastewater plants, multi-million-dollar. It is a very complex business, the development of new facilities and managing construction and putting the finances together to match the resources. So your background is a perfect fit for our community.
I think so, and I think that was one of the key things that drew me here. My husband and I, we were looking for a small community that we could join. We were specifically looking for Central or Northern California when this opportunity came to me and was recruited to come here. Both because I have a lot of experience in turning hospitals around. I have turned 40 around out of bankruptcy into successful hospitals
40.
today.
That's quite a track record.
Yeah, I'm actually very proud of that because my primary goal is to make sure that we do not create what is called a healthcare desert. And that's where there's a series of counties and its surrounding areas that don't have access to immediate health care. And those healthcare deserts are making the mortality rate in the United States go up because people aren't surviving the drive to the hospital anymore when these small rural hospitals are closing. So I'm really excited that I've been able to take part in saving those hospitals and keeping healthcare where it needs to be, and that's in the communities.
Can you talk to me a little bit about how we got into such a financial crisis here?
Sure. So healthcare, you don't get paid for every dollar that you bill. It's all based on contractuals and what the government wants to pay you through their Medicare and Medicaid. We have what's called Medi-Cal here. So each one of those entities pays you something a little bit differently. So you have to negotiate and stay within your means based on what the government can pay you. And then you have to look at your payer mix for your insurance. What are insurance paying you? Most of those are way under 50% of every dollar. How we got in this situation, as I outlined in the town hall, is we didn't turn in our audits on time and got in trouble with the federal government. We also, when we went to our outside billing company, they've made a series of errors that have cost us quite a bit of money. And then we have just, in my opinion, been fiscally irresponsible and didn't have some guardrails in for how much was purchased, when it was purchased, what contracts we have, what we outsource versus what we keep in-house, and then holding people to those contracts. So in the future, we are going to have to do one of two things. That's the only way you can turn a hospital around. One is either increase the services, increase the amount of visits that we have and people want to visit us, and the other one is to decrease what we're spending. Tighten our belt up, make sure we're using our contracts wisely, looking to see what all we outsource, see about bringing those in-house so we can manage them better, like our billing department. And then after that, after we've done both of those things, correcting everything, with our government, with all of our payers. We haven't negotiated our contracts with our private payers our insurance carriers in over 4 years. So we're going to go back to the drawing board and see what we might be able to do to get more of the dollar back and reduce the cost and increase services.
Sounds like a plan.
We got a great plan, I think.
The last direction that we got from the hospital administration was to reduce services. They were going to close down the
Home health and hospice.
right, and that stirred up a lot of interest in our hospital, and maybe led to the past administrator to move on. Is that still on the agenda?
Well, I'm looking at every department that we have, not just home health and hospice, but I'm looking at each one of them as a separate entity to look to see how many patients that serves, looking to see how we can control their expenses. And I think it's a little too early to tell because we haven't done all of our due diligence to know the real bottom line number yet.
Okay. So, with respect to the new hospital, there were rumors that you're going to have to dip into that construction fund to pay some of the operating costs. That is off the table now?
Absolutely, that will never be on the table. We actually have that monies in a separate account that we cannot touch for any reason other than for the new hospital.
Okay.
It's protected, which is a great thing, so that we have a true accounting of everything that's going in and out. And you can't rob Peter to pay Paul.
No.
With this. It completely stands separate and can only be used for that new hospital.
So, moving forward, things look kind of bright.
I think they do. I think that we have lots of opportunities to tighten up what we do. We need to improve our quality. We need to look at our providers to make sure that we're recruiting for providers that want to stay in Mariposa long term. We're looking very closely at every single employee that we hire for potential for them to be long-term employees. We really want to create the environment that not only does staff want to come to every day, that they're proud of where they work, that we treat them very well, but our patients want to come every day. If they have to have health care, we want to make this an enjoyable experience, which I don't think that's always been the case here. So we're trying to flip things and make them more satisfaction driven. We're also looking at different opportunities to affiliate with bigger organizations, and with those affiliations we'll bring more and more specialists that we'll be able to see here in Mariposa, and will provide us with some of the back end technology that we need so that we can be successful without laying that big cash outlay independently by ourselves.
It sounds like you really have a plan.
I think so. I think I have a great, amazing team of leaders who care about this hospital and care about our patients. And I think together, not just me, but together, all of us are going to create the place where we'll be proud of.
So, the first thing that comes to my mind, and this is going to be a little off the wall, but we have a lot of hospitals in our state that are having really serious problems.
Yes.
What can we look forward to? If you're going to be a very sought after person, particularly if you're reasonably successful here.
Correct.
And how long do you think you can stick around if you get just a major big offer to go someplace else?
Well, I'm going to try to say this humbly. I get recruiters that call me every day. But my husband and I have chosen Mariposa as the community that we want to live in. We'd like to spend the rest of our careers here as long as the people of Mariposa will have me. I hope this is where I finish my career and get to spend my retirement.
Okay. And your husband works for Tavis?
He does. He works in the maintenance for Tavis, and really loves what he does too, and loves his coworkers. So it was a big win for us to come here.
It's a big win for our community.
Well, thank you so much.
Lynn, I really appreciate your time, and we'll be talking some more.
Great. I appreciate it. Look forward to it.
Bye-bye.
Bye-bye.